Hi, my name is Dr. Peter Lind. I'm a wellness chiropractor specializing in chronic metabolic and neurological health conditions. Today we're going to talk about GERD, gastroesophageal reflux disease, or just reflux. You see, most doctors treat a symptom or an organ, not the whole person. That's why you can't get rid of the problem. Our patients are treated metabolically and neurologically. You see, all chronic health conditions have several things in common, such as GERD or reflux. They have an oxygen deprivation, metabolic imbalances like blood sugar dysregulation, cortisol and hormone imbalances, digestive disorders, which I'll get into, types of anemia, autoimmunity attacks, and brain imbalances. See, if you understand how your body functions, you can appreciate how it breaks down, and then you know how it can be fixed. Treating symptoms such as reflux or GERD with medications is like putting air in a flat tire and never finding out what made it go flat. Why is the symptom still there? But you keep putting air in it over and over again and hoping it goes up. You have to understand how the body works in systems and metabolic systems, and it's just amazing. So we're going to look at how the pituitary sends its hormones to the thyroid, how the thyroid sends its hormones to the rest of the body to run metabolism, what happens to the adrenal glands when they're stressed, and cortisol levels, and see what the pancreas is doing, producing insulin and glucagon. How do we know all this? How do we know how the intestines work or the esophagus works? By testing. And testing unlike you've ever seen or had before. See, there are two kinds of testing that we do. The first is a complete laboratory analysis, but this is not in pathological ranges that you're used to, but functional ranges. In the past, you've had lab markers come back and maybe they've been normal, but what you need to know is that there are functional ranges that every marker falls into. A pathological range, for example, of fasting glucose might be 64.8 up to 104.4. But a functional range, meaning a range that your body functions efficiently, will be between 85 and 99. And this goes for every marker that is tested. We look at these functionally. See, we're looking for breakdowns and malfunctions in multiple systems in your body to find the underlying cause of your problem before it turns pathological. So we're going to check TSH and T4, T3 for the thyroid. We're going to do a complete metabolic panel. We're going to do a lipid panel. We're going to check your protein levels, albumin and globulin. See, from just those, we can find out what your digestive system is up to. Important for you, we're going to do sensitivity testing on your stool analysis. We're going to take a DNA analysis of the antigens that almost every person with a chronic condition has positive. A number of years ago, I wrote a book called Barren Harvest, and it's a novel on genetically modified foods, foods that we have never seen in the history of the world that we're consuming. Corn and soy among the most prevalent. And our bodies are supposed to deal with them, and they've never seen them before. We don't have systems, metabolic systems to break them down. We're going to have problems. So we've got to look at your sensitivities, and if you're sensitive to certain foods, you must remove them from your diet, or you won't get well. We're going to run other tests, though. That's just several. We're going to run other tests on your adrenal stress indexes. We're going to get an in-depth look at your immune panels, and particularly an intestinal permeability test. See what kind of shape your microvilli or your lumen of the intestines are like. We've got to find out, or you won't get well. Things won't get better until you find out what's going on and apply the correct procedures, natural procedures to help you get better. We're going to check your hormone levels. And they're especially important if you're depressed or have fatigue or mental fogginess, if you have mood swings or sweating attacks, if you have weight gain that doesn't go away, or just decreased physical stamina that can be related to hormone levels. particularly important for you is the inflammatory markers like C-reactive protein and homocysteine. If these are elevated, and they often are, you've got an inflammatory reaction in your body that needs to be dealt with. It's like a fire that's going off that needs to be put out. See, we're looking for several deal breakers that must be addressed if you're going to get well, and these are blood sugar imbalances, either hypoglycemia tendencies or insulin resistance tendencies, fatty acids like cholesterol and triglycerides, any anemias, and in particular liver and gallbladder and other digestive imbalances. See, to understand what is affecting your health, you must be evaluated completely. We're past the days of try this Prilosec or try this other medication and see what happens, and you just got to take it over and over again. Well, you know inherently that that's not fixing the problem. So metabolic testing is one half of the equation. The other half is evaluating your nerve system functionally. Your brain and nerve system need two things to survive: glucose and oxygen. If these are faulty, your brain is faulty, and the rest of your body suffers. So we're going to do tests that may include tissue saturation levels or perfusion levels, heart rate and rhythm, reflexes, eye tests, cranial nerve tests, cerebellar tests. You see, the spinal cord carries energy from the brain through the spine like a river to all the organs, glands, cells, tissues of the body. And every cell is totally dependent on that energy. As long as the brain is receiving proper input, it can give proper output to the rest of your body. But if there's a faulty process going on, it needs to be evaluated and fixed. So we want to find out the areas that are misfiring, because if not, they can cause depression, anxiety, loss of memory, loss of sensation, anger or irritability, balance disorders, and dizziness. These are faults of faulty brain patterning. For example, take peripheral neuropathy, which is pain in the hands and fingers. It's caused by blood sugar problems. Well, you get damaged because you've got a faulty fuel supply. Is it a lack of medication problem? No, it's a faulty metabolic problem, and it needs to be fixed. You've got to fix the problem by understanding what's going on metabolically. If it's a neurological problem, you have to find out what's going on neurologically and check the functional ranges as well. Gut infections, blood sugar imbalances, thyroid disorders, autoimmune processes that are going on, then you can address these and get the problems under control so that your system doesn't break down and give you the symptoms you have. So with metabolic protocols, once we get this information back, we can design custom protocols for vitamins, minerals, and supplements, things that you don't have in your diet that are giving you symptoms metabolically. We want to give you customized nutritional plans like what to eat, what not to eat, when to eat, and how to eat. We can basically change your lifestyle. Brain-based therapies are all neurologically based and clinically proven, and they may include exercise with oxygen, getting tissues saturated again with oxygen. We want to do maybe electrical current or microcurrent or other stimulations to get movement and function back in the parts of your body that don't have it. If you have faulty input, we want to improve that with maybe visual or auditory stimulation or tactile stimulation. You see, all health problems are a combination of causes. Most health problems are syndromes involving multiple systems. Correcting the brain misfiring and metabolic dysfunctions help the body to reassemble itself back to health again. And retesting lets us know we're on the right track with our treatment protocols and allows us to make correctional changes quickly. We treat the whole person by striving to bring all the pieces of the puzzle together at the same time. Well, here's what to do next. We begin with a 2-visit protocol. You call our office and schedule an appointment. You fill out the paperwork while you're waiting to get in and have it on my desk, and any recent lab work you've had in the last little while. And you do this before your first visit. Then on the first visit, I'll go over this with you and perform a functional neurological exam, and then you'll be dismissed. And then on the second visit, I'll have a chance to go over this information. We'll review the neurological findings and discuss why I am or am not able to accept your case. If your case is accepted, we will discuss what functional metabolic testing will be needed. The preliminary